King's College Hospital in London earlier this month. He was confronted by consultant anaesthetist Dr. Steve James. Dr. James told Mr. Javid that he'd been working in COVID ICU. He already had his own antibodies, and he questioned how long the vaccination reduced transmission for. And his belief is that the science isn't strong enough to support compulsory vaccination for NHS staff. That raises a number of issues. The freedom of choice to be vaccinated or not, the protection of NHS patients from COVID, and just how effective is the vaccine, particularly if you've had COVID already. Maybe you are an NHS worker and you feel strongly about the subject. Do send us a text to 88291. Do email vine@bbc.co.uk. I mentioned Steve James, the consultant. He's actually with us now. Hello.
Hello, Jeremy. Thanks for having me on.
Not at all. So I guess you still haven't had the vaccine. Is that correct?
That's correct. I haven't had the vaccine.
And take us through your reasoning again.
So my reasoning was, first of all, I was watching patients come into the intensive care unit with COVID. I was looking at their health profile. I could see what was making up the susceptible group. And I assumed that when the vaccines would be developed, they would be of benefit to the vulnerable group, which indeed they seem to have been.
And when you say the susceptible group, you mean people with other conditions, classically people who are overweight, is that right?
Principally, yes. The elderly as well, but we know that the vast majority of people who suffer the most serious of consequences from COVID have not just got one, but 2 or 3 or 4 or more comorbidities.
There was a piece on the news last night. BBC News' Clive Myrie spent the last week at Royal London Hospital on a COVID ICU ward, where I know you've been working as well. And this is a very quick clip, but it's the intensive care consultant, Nick Bunker, who points out how many of the patients on the ward are unvaccinated.
Unvaccinated, 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 unvaccinated and unvaccinated.
And we hear that again and again, don't we, Doctor?
Yes, that's true, but I don't know whether Nick is being asked whether those patients are unvaccinated and in primarily with COVID, like a COVID pneumonitis, or whether they're in intensive care with a coincidental COVID.
What would make you change your mind about having the vaccine?
Evidence that it would bring benefit in the setting. Well, first of all, that the side effect profile was low enough for me to warrant having it. Secondly, whether there was evidence that it was going to be of benefit to me. And thirdly, whether there was an appropriate impact assessment in the right conditions to show that it would benefit patients.
What about the argument that it benefits others if you have it, because it just reduces the amount of virus being moved around the community?
So there's 2 things there. At present, infection rates, and we assume therefore onward transmission rates, are the same in people who've got 2 doses of vaccine and are unvaccinated. That's UK HSA data from the last month. So the current setup of being asked to have 2 doses of vaccine does not confer benefit for infection.
Is that correct? I've heard so many different tales, but the person I always go with is our virologist, Dr. Chris Smith, who says that you're 60% less likely to catch it if you're vaccinated, which means you're a lot less likely to pass it on because you didn't get it in the first place.
But the data for the current period with Omicron is not saying that. It's showing...
that's Omicron, right? But I'm just saying, if you're less likely to get it, you're less likely to pass it on, right?
But that's not relevant to the current climate. We need to continually review the data. We can't just go on data from an old situation and say that's still relevant now.
What about if you have patients who say, I want the staff to be vaccinated, which I guess is not unreasonable. This is the journalist Yasmin Alibi-Brown. Just going to play a clip. This is her speaking yesterday on Channel 5.
It's good to give them more time. But I really think that unless there are medical reasons why certain members of staff cannot be jabbed, I think when you're working in the NHS and care homes, you really should get jabbed. And I think this is the way I would look at it. Those who haven't had jabs but could have jabs need to have a badge saying unjabbed.
Really?
Yeah, and I would not let them treat me.
What do you say to that?
I understand that woman is wishing to express her preference. I also wish to express my preference. If the government decides that my preference means that I do not want to take the vaccine, then I won't be working and I won't be contributing towards the NHS. Well, the families I've spoken to since I've come onto the news, they've all expressed support for me and said they're very, very happy to have me still treat them.
Well, there are a lot of other people who are obviously, for whatever reason, in your position, and we think 80,000, that number may be reducing as the date gets closer. But it is getting closer, and it sounds, from what you're saying, Steve, as if you won't have the vaccine before the deadline. So are you making plans to leave the NHS?
At the moment, I'm taking it day by day. I'm looking at what we can do to help get the government to look at the current situation, to look at what they are asking. They're asking us to take 2 doses of a vaccine that is currently not reducing infection or transmission, that hasn't finished its trial period, has a highly concerning reporting rate through the yellow card system for adverse events, for a disease with a morbidity profile that's similar to flu, and where they won't consider natural immunity. That's just what the situation is right now. So I'm going to work as well as I can against that while maintaining my clinical duties.
Isn't it the case, and you're a medic and I'm not, but the reason we are just beginning to get out of this horrible thing is the vaccine. And if it wasn't, before we had the vaccine, we had 100,000 or more people dead.
If you look at the countries with the highest vaccination rates in the world, France and Israel are good examples of that. They've currently got very large peaks in hospital admissions. So that doesn't confer with the data. When you look at South Africa,
so it's better not to have a vaccine. It's better to have gone. Do you think if we went back through this thing again, you would say, don't roll out a vaccine, just allow us to have it, recover, and use natural immunity?
No, I'm not saying that. What I'm saying is the data at present is showing that vaccination is not protecting against admissions to hospital. Vaccination is showing...
Yeah,
so
admission, I don't understand.
So you've got infection, you've got hospitalisation, and you've got deaths. The deaths occur in the group that are most vulnerable to the virus. In that group, triple vaccination seems to still confer benefits.
I see. And just in an entirely selfish point of view, from your point of view, Steve, you're a young man, you're actually younger than me. I guess that the argument might be, OK, you're not going to die from COVID. You wouldn't die from it if you got it naturally. It'd be very unlucky. However, you could get long COVID. And, that can really smash a person in for a good year.
That's correct. And
you think you're just happy to take your chances on that?
Well, I've worked alongside patients with COVID for the last 22 months. I know I've got antibodies to it. Having been continually exposed to little bits of virus in the air, my immune system is probably more primed and able to handle it than anybody else. I'm very comfortable with that.
OK, thank you very much for giving us your time today. That is Dr. Steve James, the consultant anaesthetist who confronted the Health Secretary because Dr. James doesn't want to have the vaccine for